Hello, EGP learners, and welcome to this our kind of review session of 2020. And we're joined by Ben Gowland. How are we doing, Ben?
I'm great. Great to be here.
And how are we doing, Andy?
Oh, I'm good. Great to be here as ever.
Can't
So
believe we did this last time.
we did. So for those that don't know, and I'm not quite sure how you won't know, Ben, if you've at all listened to any of the stuff we've done, or if you work in general practice and stuff. So Ben's the kind of host of the General Practice podcast, an amazing podcast, which I highly recommend that you have a listen to. Not just the fact he seems to keep having me on it every
Thanks,
week.
Gandhi.
But it's a great resource in terms of listening to obviously content and stuff around general practice. But we wanted to bring you back because we did some rather interesting predictions from kind of last year, and obviously this year's been different, shall we say? We wanted to kind of talk about what would have been happening. So, what do you think, Andy?
Yeah, so I would say what a year we've had. I think when we were all sat here a year ago, none of us were predicting that there would be a once in a century global pandemic event, which is what happened. So it's been a really crazy year, I'm sure, for all of us. We've done all sorts of things in all sorts of new ways. It's been both horrible but also challenging and exciting in many ways. And I think it's a good opportunity to kind of review the year, really. So I'm quite looking forward to it. I suppose just to orientate the listeners and viewers, we're going to sort of just walk through the year, take a sort of season by season approach, a sort of narrative storytelling approach to how each of us really have found the year as it's developed through its various stages of the pandemic and everything else that's been going on with primary care networks and in primary care and general practice in general. So I guess that's what to expect.
Mm-hmm. And we thought we'd cover this by kind of going through the year itself. So picking up from where we left off this time last year when all three of us were kind of chatting around primary care networks. I mean, remember that, everyone? When the kind of DES was just coming out in terms of what it was going to look like, what people need to sign up to, the specifications, the 5-year kind of plan and all that kind of stuff was coming out. And yeah, so that's where we were then. So we're going to talk as if how it was back in winter 2019 and spring 2020. Ben, I mean, what do you remember of that time?
Well, it was an interesting time, wasn't it? I mean, it's hard to remember anything before COVID hit. But if you do think back, I remember we talked about those draft specifications that come out for PCNs, and the sort of unrest that caused. And then of course we got into January, if you remember, and the specifications were changed, and suddenly we were getting 100% reimbursement for the roles. The specs were down, and there was still a bit of should we or shouldn't we sign up to the PCN DES? And then there was the LMC conference where all looked a bit in the balance, but that was like the week before COVID struck. So there was this kind of sort of PCN noise, wasn't there, like before COVID? But then that kind of dissipated really when it just got overtaken by events.
Yeah, it's a slightly controversial thing because I believe the LMC conference actually voted to pause the DES, if I remember rightly, or something along those lines. It was a vote by the conference themselves to say, actually, we want this renegotiated. But then, unfortunately, or fortunately, I don't know which side of the line some may sit on, but a week later, COVID hit, and obviously that's when things changed like crazy. What do you remember? What do you remember about that, Andy?
Oh yeah, I remember having really difficult conversations at the beginning of the year with the practices in my primary care network around these enhanced specification and around the DES specifications, and people actually were telling me that they didn't want to carry on with primary care networks and that they might opt out. But then the new revised specifications came out and everything looked a bit more favourable, apart from perhaps still some concerns around the care home enhanced service specification element. But it made it a lot easier to convince people. As you say, it's hard to remember back then, though. It all seems like more than a year ago.
Mm-hmm. Ben,
it was interesting, wasn't it? Once COVID hit, and then a lot of the funding that was being put into general practice was coming through primary care network. So it kind of got to the point, didn't it, where it came up to, remember, we still had that kind of, you've got to sign up again. I think it was the end of April. Mm-hmm. But at that point, really, you kind of had to, because you didn't want to not get the funding that was coming to general practice for COVID. Plus, of course, you were getting, the 6 months of the impact and investment fund as like almost like free COVID money. So it kind of went away, didn't it, just because of what happened.
And I guess from your experience, Ben, with that kind of period, particularly just before April hit, I mean, there was that point where a lot of networks had potentially funds that they hadn't been able to use, and people were trying to figure out the best way to use them to benefit, the practice, to benefit patients, and the longer term plans and stuff. Uh, how was that experience for you? Because I know for us it was a bit of a challenging thing because we were knee deep in COVID and all the change that was coming around. It was a bit chaotic, wasn't it?
It was really chaotic, and I think there wasn't because it was the first year of PCNs. PCNs hadn't really kind of worked through what do we do with funds that are left, and do we distribute that to practices? Do we keep it invested? There's this whole issue then of practices having to pay a tax on the profits that PCNs had made, and that sort of came out, didn't it, through the year? So that was like, oh, hold on a second, how are we going to work that one through? So I think it was a learning piece. I mean, the other thing, of course, that happened was there was some underspend on the ARS funds. And I think what's interesting about that is that was kind of handled differently around the country. So in some places it seemed to disappear, and in other places it was kind of offered back to the PCNs, and they were able to kind of find ways of using that money the year after. I think we'll see the end. That isn't going to happen again by the sounds of things this year. But that was good that at least some of that money got reinvested.
And then obviously from then we kind of transitioned into the impact of COVID itself. So this was around at spring to summer 2020. I mean, this was probably the biggest shift in general practice we've ever seen, that March, April time, when it fully hit the UK in particular. What are your memories of that, Andy?
It still seems like a very long time ago in itself, actually. Yeah, gosh, so much to say, really. I mean, what struck me about that period was how, in a way, PCNs actually came into their own, really, or there was suddenly a value, certainly, I think, in Nottingham, of having practices aligned with networks in a structure where there was a network leader. And I think actually that was a big help as the system needed to respond to COVID-19. Actually, there was actually a sort of ready-made structure that the system could use to deliver information and also check in with practices to see how they are doing. I know that for a long time, we were having weekly Zoom sort of pandemic meetings with practice in the primary care network. They could compare what they were doing and sort of calibrate themselves with one another in terms of what they were doing in terms of seeing patients, how they were handling their PPE issues, were their doors open, were they closed, to what extent were they at total triage. So I think actually that was a period where the system needed to adapt really quickly to a huge change. And I was surprised how well we did it, actually. And I think primary care networks, together with some of the new technologies, which I know we've all talked about a lot in various forums, like Zoom, for example, and video meetings, and WhatsApp, and the kind of text-based communication channels. I think they all came into their own and all helped primary care respond really well. So that's probably the main thing that struck me about that initial period. I mean, there's so much more to talk about. Yeah, Ben, what do you remember was sort of the main thing happening in terms of, well, just generally, but also on the podcast at that time for yourself?
Well, I mean, for the podcast, it was interesting. So, we record episodes, in advance, and it became immediately apparent to me that, a lot of those episodes that we'd recorded just weren't relevant, because there was an environment where people just wanted to, there was this thirst for information about COVID and about what to do, and hearing about some of the stuff that we had around primary care networks and some of that stuff just wasn't relevant. So I thought we were going to pause the podcast, but then interestingly, what happened was people started getting in touch saying, "Oh, we're doing this and we're doing this," and I thought, well, this is a great way of being able to share information, because I always think podcasts are great for kind of sharing case studies of what's actually happening rather than policy stuff and that kind of thing. So we kind of sort of pivoted our content really quickly into kind of what people were doing in response to COVID, and ended up with just tons of content, and just there's no way we could have got all of it out. People were sending it to, like coming to me and saying, we've got this great example of doing this or the other. So it was really interesting as a time, and not how I expected it to go.
Absolutely. I know.
Gandhi, I'm going to accuse, so because it was an interesting time for EGP learning as well, and in many ways the growth of EGP learning in terms of subscriber base probably started to hockey stick around that time.
Yeah.
What are your kind of memories of what was happening at EGP Learning at that time?
So I remember in March, April time, literally stuck to my computer, doing various recordings and webinars and everything, just trying to help people with things like remote consulting. I mean, that was the big thing, obviously, for general practice, the shift to total triage, using remote consulting, whether it's video, whether it was telephone, all that kind of stuff. And the content we were churning out between me and Andy, on top of trying to, you know, collaborate and work with our networks and all that kind of stuff, the CMC things that we were doing, like Andy mentioned, our kind of subscriber rate just jumped by about 300 in the space of a week, which was crazy for us. I mean, that kind of growth we've never seen. But it was, in a way, it was nice because it meant that we jumped into kind of the doing all this kind of stuff a bit more, which was a nice distraction, if I'm being honest, with all the chaos that was COVID. And the type of content we kind of pivoted a little bit, didn't we, Andy? We were a bit more focusing kind of like deep dives into how you can use tech in practice, but this shifted us towards remote consulting, Zoom, Teams, all that kind of stuff. And keen to just try and support people with the content we've been doing, and then we've been doing that ever since, really, which has been nice. And it kind of made us go to the regular scheduling of every 2 weeks as well, which was interesting.
Yeah, and it's been interesting. We've been doing things remotely as well with people that have been interviewed and so forth. I think it's sort of changed how the podcasts are and YouTube videos are produced as well. I think it gave us a push and a challenge, and I think they're probably better for it as well, which is good.
Absolutely.
I think you guys did an amazing job at, supporting practices who just weren't, trying to get used to something really quickly, and having the resources that you guys provided. I think, and I know lots of people that I've been in contact with found them really, really useful.
Yeah, I think some of the YouTube videos with the highest numbers are some of those videos that we produce that can be sent to patients via text message, like how to start your video consultation and things like that. So I think some of the practical content was really popular that we'd produced at that time.
Yeah, so I think 3 of our biggest videos are how to take a photo of your throat, how to send a picture to your GP, and how to start a video consultation with your GP. Just those 3 videos alone are like majority of the content views and stuff we've had. And then our kind of guides that we've had more recently, which we'll come to in a second, for general practice in terms of the COVID enhanced service and all that kind of stuff. But I'm jumping a little ahead. Let's go back to summer and autumn 2020, which was supposedly the R&R period, I think, or whatever it was called. Ben, I mean, this must have been an interesting time for you because obviously things changed drastically in some ways, didn't it?
It was interesting. I mean, I don't know what it was like for you guys. I mean, so in that first COVID period, it'd been really quite intensive. I was working with Federation and PCN, so we were setting up red sites. We were trying to, how do you create green sites? Remember that for childhood immunizations, and we were we're dealing directly with China to try and get PPE. And I mean, it was a crazy time. And so then, kind of when the lockdown ended, and we went into that next period, practices started to open, or they weren't seeing. It was quite quiet. Do you remember? I mean, certainly for practices in that initial period, and then we had that kind of period where people just started to think again about, okay, we have actually got a PCN, and we have signed up, and there's this massive fund available. So people then started to get into this whole recruitment program, and so where I was working, we were starting to recruit for like 60 roles across 5 PCNs. So that was kind of crazy in itself. So there was just loads going on, and then of course people were really worried about flu and how that was then going to impact. So there's this, it had worked well, I think, in COVID, sort of giving more responsibility to PCNs and federations, and I think that then carried on with flu. So there's more responsibility around that. So it felt like the work changed, but the busyness, it didn't really drop off at all.
Not at all. And I think, in that respect, people were kind of hoping the summer would be a little bit calmer, but I don't know. I remember almost every Monday seeing on social media channels and stuff, people saying, oh my gosh, if this is what summer's like, what on earth is winter going to be like? It just seemed so chaotic. And so the demand was just jumping almost every week and stuff.
Yeah, that was going to be my reflection, really. It was the recovery and restore period, wasn't it? And I remember, I think you're right, Ben, we were quieter during that initial COVID period. People they didn't want to come to us. They didn't want to go to A&E. They didn't want to go to hospital. They'd sort of received the national messaging that the NHS was busy dealing with COVID-19, and so they weren't coming to see us. And that meant that some areas of the NHS were perhaps less busy than they'd been before. But that's changed for us in the summer, and we really noticed when the messaging changed centrally about actually no. You do need to present with your red flag symptoms. You do need to present with your problems to general practice. Actually, we had a lot to do all over again, whilst still having to comply with a lot of the COVID restrictions around what we were seeing on our site and how we were dealing with patients. So we found that a bit of a challenge, actually. I also remember having conversations about what I think people thought that it was nearly over, actually. So we were having conversations about, what innovations shall we keep from COVID-19 going forwards, and things like that. We were beginning to have those conversations, and it almost felt like people thought that it was over, but I guess it wasn't, and there was another wave afterwards.
I guess the thing I remember the most was the information overload that we were having. I mean, that was definitely there during the peak of the pandemic and stuff, but even more as that was, because it was the conflicting messages as well. It was you need to do everything, you need to do this, and you need to do this, and you need to do it in this way as well. And it was just almost every week there was a new thing coming out that just meant that, okay, but that kind of contradicts this, and you're saying I can do this, but I can't do this. And it was really challenging, I think, at that point. And flu was a big one because the amount of learning we had about the flu PPE, what PPE you have to wear when you're delivering a flu vax almost seemed to change on an hourly basis, I think. Remember rightly? Yeah, that was interesting times.
It's interesting. Just mentioning PPE, I've just got another reflection. It's just going back really to spring, summer, but just something that was interesting about my relationship with the practices and my colleagues. The whole system sort of adopted a bit of a command and control posture for a while. And you'll have experienced this too, Gandhi, because you've been in the meetings, but there was a sense very much, particularly around issues of PPE, actually, that was a bit of a touch point, but there were messages coming from above that were being delivered to ourselves as primary care network clinical directors about availability of PPE and what we needed to do, and what essentially we needed to a certain extent to get our practices to do to continue to deliver essential care and man the COVID management centres that were set up, and how they were supposed to be staffed. I remember sort of feeling a bit lent on by those above me, but in turn feeling that I was needing to lean on other people, and that in some ways, whilst we were building good relationships, we were having to cash in some of that relationship capital in terms of getting the system to do what it needed to do in a command and control way. I remember getting the staff from a whole practice to they almost dragged me down to the CMC, to the COVID management centre, to talk them through why it was safe and why they could work there under the PPE, with the PPE. And I had to give them a tour and feel like I was trying to convince them to do something that that they weren't sure was right. And to some extent, neither did I, in a way, although I became much more comfortable with the PPE arrangements afterwards. So it was a very strange time. Yeah.
How was it for you, Ben? I mean, having to manage 5 networks. I mean, the thoughts and the ideas around that must have been very different.
Yeah, it was difficult because so what happened was that the CCG basically said to the federation that I was working with, so can you take responsibility, if you like, for primary care and supporting primary care? So we then worked with the primary care networks to do our version of the the COVID assessment site, and then supporting any practices that had to close down. But what I remember was it being just really, really intense. And we were it's like 7:30 meetings every day, which you can do that for a while, can't you? But I think it gets to a point where it just gets exhausting. And then and that sense, I guess, what we were trying to do, Andy, was try and prioritize safety. So we would take risks, because we did have we got some capital as a federation. So we were trying to say, okay, what did we think was safe, and only go down that route, not let other people dictate what was going to be safe for general practice, get the GPs to actually decide that. So working really hard at that, but that meant we had to have, constant conversations the whole time. So it was, and I mean, the other thing I remember is, some things we did and we got those things set up, but it wasn't as straightforward as that, was it? There were some things that we thought, well, maybe we'll set up this, we had this concept of amber sites, and we did loads of work on it, but then it never materialized in the end. So there were lots of things that we put a lot of effort into that never then turned into anything as well. So I just remember it being just frantic, to be honest with you.
Absolutely great. And I guess I remember Andy was talking about the PPE stuff. I mean, having to champion the need for things like visors, because originally that wasn't part of the general practice approved list of PPE. But I remember, like Andy said, when we were trying to set up the CMCs, that would I be happy working there without a visor? No, because of all the information that we had, and therefore trying to crowdsource those from our local area, and hats off to the Nottingham public that they responded to that to get us some well before central places like the CCG and that could to do it. And that just meant that we had better buy-in from our staff to want to support patients even further. And that process was a real challenge. I know that's one of the closest times I've come into throwing in kind of like my PCN hat, saying I've had enough, because the stress that caused trying to organize things with competing politics and all that kind of stuff was, not
Yeah,
great.
I would add, I think the crowdsourced visors were actually really key in getting the COVID assessment sites off the ground in Nottingham. Actually, that was a really sort of key piece of work that happened. Go on, Ben. You were going to come in with something, I think.
Well, just the thing that I remember being probably the most stressful was, so we ended up in this situation where it was like someone in a practice knew someone who could supply PP from China, right? So then we ended up having these Skype meetings with these guys from China, but China would only supply this PPE if cash was paid up front. And there's no way the NHS would pay this money up front. We were saying we need this cash to buy this, and they're saying, well, we can't do that. So as a federation, what we had to do is do it at risk. So we had to put the money down, and what the system said they would do, reimburse us if it arrived. So I remember that sort of really stressful period between having paid out all this cash and like just hoping this stuff arrived. I mean, it did arrive, thankfully, but I remember that being very stressful.
And then from there, we segued into autumn and where we are now, winter 2020. And it's been, we keep using this word interesting, haven't we? But, we're now in the state of trying to get back to recovery full blown, hopefully things happening. But then lockdown 2 came along, and that kind of stunted things again. And now we're obviously in the midst of the COVID vaccination scheme and what that means for general practice and things. I mean, what are your thoughts, guys?
The thing that obviously really struck me about the difference between the second lockdown and the first lockdown was this expectation that general practice wasn't going to close down and just focus on COVID. General practice was going to do everything, and there's a very clear message in it's going to stay open. It's going to make sure that we have the most successful and the biggest flu vaccination program that's going to keep going during all of this, and it's just got to do this as well at a point where people are really, really tired. And I just think the last few months in many ways have been more difficult than maybe some of those early months. I mean, there's more of a fear, I think, in those early months, but I think just the workload and exhaustion in recent months has been probably higher.
Yeah, I think my reflections are, for us as a practice, and I think locally in Nottingham, I think this is where we actually started to see a bit more staff sickness and staff absence, and for that to actually start to have an impact on the ability of practices and primary care as a system to deliver care. It was something that we did a lot of thought around in the initial stages of COVID-19, and we did have some challenges then, but I think we had more challenges in the autumn, winter, in terms of people self-isolating. I think there must have just been more COVID in the general population during the second surge, but we had more challenges. So that's something that sticks with me about that period of time and adapting around that. And the other thing is obviously the COVID-19 vaccination enhanced service and the real sort of Herculean effort that we've just been through in the last few weeks to get practices signed up or not. to that. I know, Ben, we've got had a slightly different situation in Nottingham, which you might be aware of, and a lot of the viewers and listeners. But we had quite a mature local response plan for delivering COVID-19 vaccinations, which had been in development for many months actually before, and had accessed some separate funding streams, although that was in the balance for a while. So we had in primary care a ready-made sort of plan to work with in order to deliver the COVID-19 vaccination, which I think is left us in a really fortunate position actually, because primary care isn't expecting to do as much as the heavy lifting elsewhere in the country, and that was a bit of an easier sell for our practices. Ben, what's the situation where you are, or more generally? I know a lot of places aren't as privileged as we are.
Yeah, so I mean, the place where I've been working, obviously, so the federation then has been has identified 2 sites, working with the council actually to find those sites that are not practices. So and they're wave 1 sites, so they go live on Tuesday. So it's just been totally crazy, to try. I mean, as you know, the thing that's striking is just how the information and the requirement changes on a daily, if not hourly basis. And so we're having to just redesign process flow on an almost daily basis. And so it's just it almost logistically been more challenging than when we set up the red site. I mean, the red site was harder because of, or the COVID assessment site, because of this kind of fear of the disease and this safety requirement that kind of sat underneath everything, and you really wanted to make sure it was safe. This is kind of, how are you just going to get thousands of people through, and how are you going to manage this crazy vaccine that you can't transport and you can't shake, and all of the stuff that sits around that. I mean it's a really difficult logistical challenge, and with all of NHS England and CCG and all that kind of top-down assurance, that I sometimes wonder whether that's making it more difficult rather than easier.
Mm-hmm. I think it's the difference between earlier, when it was CMCs and red sites and all that kind of stuff, was the fear of the unknown, because we still were learning about COVID and the implications and the personal risks to members trying to do that. I think with the COVID enhanced service, there's less concerns about the individual health risks of the people trying to deliver it, because we kind of know a bit more about COVID, and we feel we can deliver a lot of this. It's more then about, unfortunately, the bureaucratic element of it, the logistical element of it, and all that kind of, it's the numbers that's the bigger factor. And those numbers are therefore harder to judge, because we're talking about something that literally by tomorrow could be a completely different thing we have to deliver. And that's not something general practice is necessarily used to doing. We're used to doing things at a pace that means we can adjust it as best as we can, but make it work. And this just seems something so different, really, doesn't it? I mean, we've seen that this week with the reintroduction of the 50-minute wait time. That's, I know that's made a real challenge for many places trying to deliver the COVID vaccination as a result of it. I mean, how has that factored in for you, Ben? Because, like you said, being a wave 1 site, now having to add in 50 minutes of waiting time for every person that has a vaccination.
Well, we'd gone for these huge sites, that like town hall and a huge building. So we've actually got the space that means we can do that. So it's not. I know for some places it's actually sort of precluded them from going ahead just because they haven't got the space to enable that. So we have got the space. It's just meant redesigning the flow, changing the staffing model, doing a whole set of logistical changes. At the last minute, when there isn't time to say we'll do it the day after or the day after. You're sort of stuck with the vaccine arrives, and you've got to get it done within a number of hours post arrival. So,
Andy, what's your thoughts been over the past couple of months?
I think I'm in reflective mode now, just reflecting about the last few months and the last year, and I want to say I've actually been quite impressed by how primary care has responded to the challenge of COVID-19, and in particular, and without sounding patronising, because there's a danger of this really, but some of the practices in my primary care network are small, and the GPs or even single handers that staff them are not perhaps on the older side, but I've just been impressed that those practices have been on all of the Zoom calls that we've done. They have adapted and taken on new ways of working and total telephone triage, and adapted their models as well as the bigger practices, and they've been fully engaged in conversations about delivering the vaccine, and and had meaningful contributions to make. So I've just been impressed by the practice in my primary care network and with general practice in general. To be honest, I'm in reflective end of year mode, and I think actually there's been a lot of positives, and I've been impressed by my colleagues. So,
I mean, don't you think that one of the things that the things that sit around the COVID vaccination enhanced service is this requirement for it to be done in groups. You can't do it as an individual practice, and certainly talking to places around the country, there are there's a kind of frustration from quite a lot of practices that if they were just allowed to do it as a practice, they'd be able to get on and do this, and they're confident in that. And this sort of requirement that they do it in a single site across a primary care network is difficult for them. And I think that kind of sets us up for, I think, how things are potentially going to develop going forward. And I think people finding that bit difficult is something that potentially could continue. If you think about primary care networks then taking on extended access, and we don't know what the rules are going to sit around that, but I bet there's something similar in that type of thing. And then how do primary care networks make the best use of their staff? And this idea of just rotating staff around all the practices isn't really working. So I think there's this kind of, it's also signaling a kind of wider change that I think is going to build off the introduction of primary care networks as we kind of go forward.
Yeah, I agree. I think we saw the early stages of that with what were clinical management centres, and I think you've used the term COVID assessment centres that were a big combined effort by practices to staff together and and run and design together. And you're right, there's a similar approach with the vaccinations as well. I think we're fortunate in our area that some of the sort of first wave activity has been handled by the local response force, LRF they call it. So we've been protected to a certain extent from some of the the rigorous planning and delivery that you're currently engaged in, Ben. But yeah, I think there's a shift in the model, and I think that perhaps we've been able to deliver as groups as sort of almost confirmed and made that something that is more likely to happen going forwards, that more initiatives and activity will be kind of pitched and funded at that level. Yeah, I think you're right. That might be a really big change that's occurred this year. Yeah.
I think it'd be interesting to see how that continues moving forward and stuff. I mean, like you mentioned that, Ben, in terms of the enhanced access, that's one of the big things that we were told, or we keep being told, that come April will be the PCNs' responsibility to sort, but we've got no details as to what that means. Sorting out contracts, and some people may think, oh, it's 3-4 months away. That's not a long time to sort out some of this stuff for your area if it's something that you have to deliver on a mass scale and things. But I guess that's looking forward. We shouldn't jump ahead.
Yep.
I think looking back, if people do want to check out our kind of episode where we looked at the EGP Learning Year in Review, feel free to do so. Interestingly, me and Andy got a little bit negative towards the end of that, and rather than go back down that road, we wanted to be a little bit more positive. So we wanted to talk about our hopes for 2021. And
actually, can I just, before that, I thought we were going to just talk about personal resilience, because I think that's really important, and we used to talk a lot about it, but we don't so much now. So what I was interested in really is just how each of you have tried to be resilient over the course of this last year. So to both Ben and Gandhi, really, either who wants to go first, but are there any things that you've done to keep yourself sane or on the right track over the course of the year?
Ben, you want to go for that one?
That's a difficult question, isn't it? I think the thing that I think different people have to have different strategies and the things that work for them. The thing that works for me is doing exercise. I play tennis and I get out when I can, and I just found that I've done that whenever I've been able to. I think you kind of, because of that initial lockdown period, I think you then suddenly appreciate the opportunity to play sport and to get out and do those things. And so for me, I find when I do that, I'm able to switch off from the pressure of COVID and the response and all of that stuff. And I found that like invaluable. And I really feel for people who haven't, particularly during lockdown periods where they're not able to get, outside or get that exercise, people who are shielded. I think that particularly has been a real challenge, because I think if I hadn't been able to do that, I'm not sure how I would have coped.
How about you, Gandhi?
I think there's been a combination of things. So, definitely for me, spending more time with my family has been the thing I've been trying to prioritize, and spending time with the kids. My kids are growing up, and they're at that kind of age where they want your attention. And actually, there's that 3-month period where they were at home and I was still having to work. That was not easy, and I think the other part for me has also been actually this stuff. This stuff keeps my brain ticking. The EGP learning things that we've been doing, and it just makes me it just gives me that tiny little hit in that part of my brain of trying to innovate things and do things slightly differently. And that for me is a massive stress reliever compared to all the other things I'm doing in terms of general practice, the core job, the training, the PCN work, and that kind of stuff. So whilst I enjoy that, this is the one that makes me just think, actually, I can do this. This is fun, kind of thing. And I remember Andy asked me this once after we did one of our conferences, which was absolutely shattering. So the first conference we did, I literally, as soon as we kind of switched the off button for the video conference, but I kind of collapsed back and just sat there for a couple of minutes. And Andy was like, "Gandhi, are you dead?" So I was like, "No, no, no, I'm exhausted." But at the same time, I was just so happy. So we did it, and it was good, and it was fun, and yeah. What about you, Andy?
Yeah, so I think I'd echo Ben's comments about exercise. Actually, I think I've been exercising more this year than I have for a while. Actually, in a way I'm feeling fitter and trimmer, and better physically than I have for a few years. Started doing some late night runs. That's what I like to do before bed, which is a bit of a strange thing, but it really helps with sleep. So yeah, so physical. And the other thing which I think I've noticed this year, which I think has been really nice, is colleagues seem to have become a little bit more concerned for one another, I think, or it's something I've noticed, actually dealing with other primary care network clinical directors and people in the system, and also at the practice, people have sort of, I think we'd been perhaps primed about the importance of resilience and well-being prior to this hitting, and people seem to have been just asking how other people are, and reminding people to take breaks and look after themselves in a way that I don't think they would have done a few years ago. And I think that's been really, really nice, I think. So it's been really nice to see that. I think those are good behaviours that people seem to have adopted more these days than they used to.
Do you think relationships are kind of harder to maintain sometimes, though, through through virtual meetings? So whether it's like Zoom's meeting or team meetings. So I've kind of noticed this kind of, you don't get that break between meetings when people like travel between meetings physically, and then this sort of phenomenon of people being on meetings with their microphone off and their video off, and kind of you don't even know really, are they there or are they on 3 meetings at once? I know I know plenty of GPs are on like 3 meetings at once, and so I don't know. I think there's been a challenge to actual personal relationships that's just this sort of mode of sort of video relationships has kind of created.
Yeah, I agree. We did a video about the darker side of video meetings and touched on some of these themes, Ben. Just zeroing in on one thing, I think people have had to kind of, at least in the initial part of the COVID response, people have had to kind of lean on one another to get things done. And so they've had to do that within the meetings and sort of burnt a little bit of their relationship capital in a way in doing so. And normally, kind of before the meeting, when people are arriving or afterwards, people are able to have those kind of private offline conversations and signal what their true intentions are and their true kind of alignment within the system, and that I'm on your side as well. Those are absent. And to make matters worse, during the meeting, everybody sees everything, and often it's recorded. So you have to play your role for your part in the system within the meeting, and you can't do any of the other kind of signaling, which sometimes keeps people on board and on side. So I think it's negative for relationships in a way, from many directions. So yeah, I agree. That's been a challenge. But the person to person relationships that I've experienced have been, I think, richer because of COVID-19 in the challenging year.
I think it's more, I see it slightly differently. I think communication has improved because of this kind of method, but the personal connection has been a bit more challenged in terms of the one that you'd have with a group or with individuals, because like you say, it's harder to just have that sit down kind of relaxing chat because we're not able to in some situations. Nottingham's been tier 3 for past 6 weeks or something like that. So, you can't even go out and have a coffee with somebody in their own home because you're not allowed to. And that's weird. But I think communication improved, connections slightly different.
Yeah, not the same thing, I suppose. So yeah, sorry, I just interrupted the flow to ask that question because it was something we'd talked about, and I was just keen to know how people maintain their resilience. Carry on with the program, Gandhi, for us.
Let's have a look towards the future then. Let's have a look at what the positivity we think. 2020's almost done and dusted in the history books, and it's definitely going to go down as one that we're probably not going to forget for a long time. But what do we think is going to happen moving forward? So particularly our hopes and our positive elements for 2021. How about we go to Andy and then Ben? How does that sound?
Okay, I'll take some low hanging fruit then. So I'm hoping for a successful delivery of the vaccination program. I mean, I think it's hard not to have that as a hope because so many things depend on it, really. One, I hope we do a good job so that general practice, is perceived as doing its role and doing its part. But more importantly, I think it's the way that we get back to normal life and being able to practice in a more normal way, and that we avoid deeper economic and social consequences, which I think we'll be picking up the pieces of those enough in 2021 and beyond, and the impact that those things will also have on people's lives, as well as long COVID and bereavement and everything else. So I think it all starts with a successful vaccination campaign in spring, summer 2021. So that's what I'm hoping for. All sorts of other things. I'm interested to know what you guys are hopeful for.
Ben, you want to go for it?
Well, I mean, I have to agree with you, and I think right now, from where we are, we're in a difficult place, aren't we, as a country? And I think I'm very confident that general practice's ability to run the vaccination program is going to come through, and it will be a successful event. Obviously, there's going to be hiccups along the way, but I'm really, really confident that that's going to be a success. And I think that the hope is that we can, as a whole, build on some of the things that have happened and use them positively. I guess there is this kind of risk, isn't there, that one, at some point everyone's just going to collapse because they're so exhausted, and another, people would just say, I just want the comfort of the way things used to be. And I think there's a kind of, my hope is that we can build on the things that are good, but revisit, like we were just talking about, some of the personal relationships and the personal connections that I think are really, really important to sort of long-term sort of success.
Go on, Gandhi, what are you hopeful for?
So I'm hopeful that my son can have a birthday party with his friends, because that would make him amazingly happy, and that would make me amazingly happy. And it's not till October, so I'm kind of hoping that's doable. So yeah, I'm gonna go for something hopefully realistic. I think in terms of general practice, I'm just hopeful that we can continue to take the positives of what we've had. The collaborative working, the options of using remote working to better suit patients and practices in terms of what we're delivering, and being able to have the freedom to do that. That's my, I guess, slight concern, that we won't have that ability to do that. But I think there's been some really positive things that come out through this in terms of the way that NHS England in particular have been working with general practice. Don't get me wrong, there's been some absolute corker blunders that have come with it as well. But I think, trying to recognise that general practice continues to be the driving force for the healthcare service in this country. And I hope that we don't lose it in the way that people are starting to look at it and things, and think, actually, what is it? What's the next stage for us once we move past, whatever COVID has done and continues to do. Does that make sense?
It does, and it's nice. It's nice to end on a positive note, isn't it? It's been a hell of a year. It's been really difficult. I know other people have had much worse time of it than I have. Through the year, and but I'm sure 2021 will be better. To be honest, I think everybody will, once it's over, actually maybe we'll be hit with a bit of a wave of positivity as people just think, thank goodness, and let's have the birthday party, let's do all the things that we've been putting off, the holiday, everything. So we, by the end of 2021, hopefully we'll all be rebounding and having a much better time. So I think that'd be really nice if that happens.
Fingers crossed.
Yeah, fingers crossed.
So we hope you've enjoyed this episode. We hope we'll also be able to bring this again to you next year and see what another year has brought us. Hopefully it won't be anywhere near as crazy as what 2020 has brought us. I don't think we could take another year like this, to be honest, but we shall see. Thank you for joining us, Ben. It's been great having
Thanks
you.
for having me.
join us again. And I know that, we love having you here. And again, open invitation for next year to come join us and recap 2021, moving to 2022. Wow, seems so far away. And as always, EGPers, thank you for joining us. Hope you enjoyed this. Leave us any comments or questions. And for those listening on the General Practice Podcast version, hi, welcome. And we hope you enjoyed it as well. And as always, EGPers here to help save you your patient's time by taking out your primary care and learning. And we'll catch you in the next episode.